Hello, today a young girl presented to our clinic. She's around 16-year-old. She presented to our clinic with complaining of kind of staring-like appearance, which was noticed by her relatives and friends. And the thing is that in that case, usually what we think about is first, what diagnosis we think about is thyroid eye disease. So is it a thyroid eye disease? We have to make sure. Yes, first we have to keep the differential diagnosis first as a thyroid eye disease, because eyelid retraction is one of the hallmark sign of thyroid eye disease. So this is a case where she has presented, and whenever you think of eyelid retraction, you always have to compare it with the normal. So the normal where the upper eyelid rest is around 1 to 2 millimeter below the corneal limbus area, and the lower eyelid usually rest on the limbus. And we can see here this video, she has when she has a neutral gaze. So in the primary gaze, what we see is that there is no sclerotia in the upper bulbar area, but we can see the upper eyelid rest just in the limbus, which means there is a mild retraction in the upper eyelid. And the lower eyelid, which normally the lower eyelid should stay on the limbal area, we can see some scleral show there. So there is definitely eyelid retraction, and she had eyelid retraction in both eyes. And usually eyelid retraction is a hallmark, a sign of thyroid eye disease. And whenever there is in thyroid eye disease, because of multiple reasons, one of the factors being the fibrosis, deposition of immune complex mediators deposition. We have fibrosis of the levator muscle. So what happens is there is retraction in both upper and lower eyelid, and lower eyelid retractors also get fibrosis. That's how the mechanism of eyelid retraction works in thyroid eye disease. And when the patient looks down, usually there is a lid lack. So in this case, what we can see is there is not much lid lag, but that doesn't rule out thyroid eye disease. So we have to go further with other symptoms and signs in the history, clinical examination. We have to rule out thyroid disorder, and for the lab works, we have to do a thyroid profile.